Welcome everybody to the first Nebraska Civic Health Summit. We're so grateful for you to be here. I'm Amanda Barker, the Deputy Executive Director and Director of Civic Health at Civic Nebraska. I was a board member of Nebraskans for Civic Reform, which was what we were at the time in 2015 when we first published our 2015 Nebraska Civic Health Index. And at the time, sitting in a board meeting, I remember being really excited that we were focusing on such a concept. I think I poked my predecessor, Kelsey, and said, "Hey, I'd love to help with this." Since I then joined the staff in 2016, I've been looking forward to the opportunity to publish another index. So today is especially momentous for me. I'm joined by my colleague, Daniel Bennett. Daniel, if you want to give a wave.
Hello, everybody.
Daniel is our Rural Civic Health Program Manager, and he has been a tremendous partner on this effort. So I'm grateful for Daniel to be here as well. If you have any technical needs right now or throughout the day, feel free to chat. Daniel is the host, so you're welcome to use the chat feature, or you can email him at daniel.bennett, that's 2 N's, 2 T's, at civicnebraska.org. We're truly grateful for your time today, and we look forward to hearing the valuable perspectives that each of you brings to our understanding of civic health. While I'm disappointed that we can't gather in person, I am grateful for the ability to pivot this work to a virtual space, and grateful for your flexibility in making that happen. And honestly, if we see any sneak peeks of your furry coworkers, your tiny coworkers, or your partner spouse coworkers, I know I'll enjoy the glimpse into your home worlds. I'm especially grateful to the public health professionals on this call. Thank you for doing everything you've been doing to keep us safe and informed during this time. So for the next half an hour, we will quickly move through some introductions of our working group, an overview of civic health and really why it matters, and dive deep into the data itself, which will follow along with that summit briefing that we sent out on Friday. We'll wrap up with some housekeeping items and reminders for our focus group work later today. So that's the agenda for today. Our working group on this project has been incredible to work with. You can see them listed on the screen here. They've assisted Civic Nebraska over the course of several months in our research design, our framework design, data analysis, partnership development, and beyond. We deeply appreciate their time and expertise. So thanks to Janelle, Brandon, Kenya, Don, LJ, Molina, and David especially. Also, a huge thanks to our funders, the White Family Foundation. They were one of the first supporters of the 2015 index, and they've continued their support of the 2020 index. This today would not be happening without the White Family Foundation, so thank you. We also want to thank the Bryan Health Foundation for their support of this project as we explore the connection between civic health and public health. So thanks to both of those funder groups. To give you a little bit of context for today and the work moving forward, we wanted to provide this timeline. So as I mentioned, in April of 2015, we published our Civic Health Index. There's a handful of folks on this call who were a vital part of that effort. And honestly, in 2018, we began planning for a future index, tentatively for 2020. So by the time October of last year rolled around, we convened our working group for the first time, and generally meeting monthly, those working group members that you saw on the previous slide. In January of this year, we got our first set of data for the Civic Health Index, and we were meeting monthly again to review the data, pull out some themes and important structures. Which brings us to today, May 2020, the Civic Health Summit. And this is really an opportunity not only for us to gather, connect, meet perhaps some new faces and reconnect with some old faces, but also to gather some qualitative data to inform our Civic Health Index. We desperately want your input on the Civic Health data, and we want to ultimately, your work today will help generate a set of statewide action items based on the data. After today, we'll do a little qualitative data analysis. We'll write the report itself, and we hope to publish in mid-August of this year. Following that, in September, we'll be hosting a Civic Health conference. Stay tuned whether or not it's virtual or in person. But regardless, it will be a free conference-style event to build civic health literacy for a large and diverse group of Nebraskans. We hope to include some breakout sessions in specific content and action areas in that fall conference, in the hopes of driving action and investment in ultimately expanding the impact of the 2020 Civic Health Index. By and large, our key goals for the 2020 index is to make the report relevant and accessible to a wide audience of stakeholders, many of you who are here today. We want to inspire collective action amongst the stakeholder group to tackle inequities in civic opportunities and improve Nebraska's civic health overall. Something we realized over the last 5 years at Civic Nebraska is that Civic Nebraska does not own civic health, the concept or the work. We depend on this broad group of stakeholders. So again, your voice is important and we're really grateful to have you here today. So what is civic health? If you accepted our Eventbrite invitation to a Civic Health Summit and you didn't know what civic health is, that's okay. It's a term that most folks aren't super familiar with. We've been working to expand understanding of civic health as a concept and practice across the state. Usually I begin by paralleling civic health to physical health. So barring chronic conditions, there are a handful of habits or actions that you take to be physically healthy, right? Those habits or behaviors might include exercising regularly, eating nutritious and balanced meals, getting enough sleep, or even consulting your medical experts, your doctors. So if you do those 4-ish, 5-ish things, again, barring any chronic conditions, the likelihood is that you'll be physically healthy. Civic health is similar. There are a handful of metrics and activities and indicators that if you engage in these positive civic behaviors, your communities will be civically healthy. They'll be strong, they'll have strong civic infrastructure, and your communities will likely be more active, vibrant, and connected. So what you'll see here is the official definition, not just a parallel to physical health, but the official definition that will be included in the 2020 Civic Health Index. Really what you need to drill down into is those 4 indicators towards the top: social connectedness, political involvement, community engagement, and confidence in institutions. We'll be talking about the first 3 of those indicators today. The 4th one we had an issue with, which I'll explain in a little bit. A quick note or a word on why civic health is important, at least to Civic Nebraska, and then Daniel will jump in and explain kind of some overall importance of civic health. But civic health is really foundational to our mission at Civic Nebraska. We believe that for our democracy to thrive in our state, it's imperative that we cultivate strong civic health in our communities. We believe that power is inherent in every person and in every community, from our smallest communities and towns to our biggest city. We, the people, as we think of it, are the principal check and balance on our government through our votes. And if we are to have elected officials who are accountable to our communities, then we must ourselves be accountable through participation in civic life and demonstrating the values we wish to see in our power structures. So civic health, more than just being a standalone program area at Civic Nebraska, is really foundational to everything we do. I'm going to turn it over to Daniel Bennett to touch on why civic health is important in a myriad of other ways.
Okay, thanks, Amanda. So everybody comes at civic health and has a little bit different perspective of why it's important to them, depending on their gifts and what area they work in and their interests. I come at it from a background in community planning, but I'm going to share a little bit about these 4 aspects of how civic health is important in communities with you. So thanks for being with me as we move through them. The first I'd like to mention is that civic health plays a role in economic opportunity. How people with talent are connected and encouraged, where investments are made and how they translate to opportunity and well-being for residents, how plans to create new jobs are coordinated with housing and transportation, These all rely on connections and local decision-making capacity of a civically healthy community. Also, the entrepreneurial ecosystems movement that seemed to be gaining some steam across the state, and strategies that build on assets from within, rely on a culture of trust and collaboration and inclusive on-ramps to being involved. But recently, we've also seen how the social capital of a community impacts economic resiliency in hard times, whether it was last year's floods or businesses working with a local bank to access pandemic relief money. Trust and relationships increase resiliency. With community development, a lot of us think about neighborhood and community projects that improve quality of life. Anyone who's worked on some kind of a revitalization project in the town or neighborhood that maybe hasn't seen a new house or business in a while, you know how many people and layers of resources are needed to come together to make a project happen. It takes cooperation from the private sector, government, and community to make these projects work. And it's relationships and local boards and volunteers that really facilitate this coordination. I've also appreciated some of the placemaking frameworks, whether it's creative placemaking or transformative placemaking, which pay attention to the local capacity to make decisions, cultural context, network building, social vibrancy. All of these things are rooted in our relationships in the way that we participate in building of our communities, not just focusing on what gets built. The CDC also lists social cohesion and civic participation among the social determinants of health. If someone has difficulty finding nearby work, or they live near rundown buildings, or if a park project or revitalization effort can't get off the ground, down the road, we know that that's going to affect the health and well-being of people who live in that area. But also just the actions of connecting with other people and being involved in something meaningful are also important to feeling good about yourself and where you live. Sense of belonging and relationships that you can depend on. These are all important things for our health and well-being. And lastly, we're eager to see upcoming generations form civic habits and care for the community around them. This is something that's particularly important to us at Civic Nebraska and to many of you who are on the call as well, whether you're parents, teachers, or coaches. You know, we're not neutral on whether being involved in your community is a good thing to do. We think it's a good thing. And so for many of you who provide a positive example and opportunities for youth to be involved in your communities, it's because you believe that it's an important facet of character, of who they're going to grow up to become, and therefore who we want to become as a state. So hopefully you see yourself in one of these 4 areas that I've just shared, and I hope you'll keep those in mind as I pass it back to Amanda, and we now turn to the data.
Excellent. 2 quick notes, one on methodology and one on our demographics. You'll see our methodology here. Civic Nebraska does not administer the surveys from which the data is compiled. We do use the data from these 3 sources primarily. The top 2 you'll see are current population surveys from 2017 and 2018. That's administered by the U.S. Census Bureau, something we're all probably familiar with here in 2020, a big year for the Census Bureau. One of the supplements, or CPS supplements, is volunteering and civic life, which informs much of our 3 indicators. The average response of Nebraskans was around 750 Nebraskans responded. Same with the voting and voting registration supplement that was conducted after the 2018 general election. Both of those current population surveys were done by phone. So they called respondents and asked the questions. For the first time ever, we're excited to include a statewide or local data set in our Civic Health Index. We're including the University of Nebraska's rural poll from 2019. That is a by mail survey, so that the paper surveys were mailed out to non-metro folks or rural folks across the state of Nebraska. And you can see a much higher response rate, nearly 1,800 folks. We have a handful of Nebraska rural poll folks on the call with us today, so thanks LJ and Brad for joining us, and perhaps others. In terms of respondent demographics, so who are the people that are responding to these surveys? You'll see overall that the CPS respondents are fairly closely aligned. Those numbers match fairly well with the demographic breakdown across the state. That far right column titled Nebraska, which is a 2018 American Community Survey breakdown. So those numbers from CPS data match that far right column pretty well. There is a little bit of underrepresentation in minorities and slightly higher income folks in this sample. We've included a geographic demographic breakdown, some race and ethnicity breakdowns, educational attainment, and income. And we'll touch on various components of these demographics as we work forward through this. All right. As I mentioned briefly towards the beginning of the presentation, we lacked data from the current population survey in 2017 about people's confidence in institutions. While we hope to address it in some manner in the eventual 2020 index, perhaps with some rural poll data, because they asked some confidence in institution questions, we aren't able to take a statewide data-based approach to measuring or understanding that indicator at this time, something we've all been grieving a little bit at Civic Nebraska. But with no further ado here, this is the state of civic health in Nebraska as of 2020. It stayed relatively steady since 2015 with some changes across various indicators. So let's dive in. Social connectedness is our first civic health indicator. What you see on the screen here are the actual questions that respondents answered on the CPS survey, and they included spending time with family and friends, having conversations with neighbors, having conversations with people different from you, doing favors for neighbors, and providing help to people in your network. The responses focused on frequency of each of these habits. So the frequently column or selection response, it indicates that it's at least once a week. Infrequently is a very broad category, which can indicate that it's happening maybe less than once a week or even less than once a month, but it is still happening. And not at all is face value. It is not happening at all. So when we look at the data, obviously, since this is the second time we'll be publishing Civic Health Index data for Nebraska, we can put our 2015 index data or the 2013 data right side by side with our most current data. So you can see that social connectedness is a split tail, essentially, in Nebraska. We spend time with friends and family frequently, but perhaps not so much with those who are different than us. We rank in the top 10 in 2 of these metrics, but we rank kind of towards the bottom, or definitely lower half in our states in terms of spending time with people of different backgrounds, doing favors for neighbors, or providing help. You can see anything that's grayed out is metrics or data that we didn't have either in 2013 or 2017 because the questions change. As we drill down a little bit farther, one thing we wanted to pull out was the connection amongst people with different backgrounds. That's one metric in which Nebraskans didn't do particularly well. So in order to tackle inequities in civic opportunities and improve overall civic health, this will be important to discuss in our social connectedness breakout session. From this chart, we see that younger people are far more likely to spend time with people from a different background than them. That's roughly 70% of people under the age of 25 compared to 15% of people over the age of 75, a pretty big swing. When we look at the same question from a geographic perspective, we find that people in metro areas or urban areas are more likely to spend time with people from different backgrounds to the tune of 60% of frequency as compared to those rural residents or non-metro residents. We also looked at income in this indicator too, which we don't have as a chart here, but we found that the higher income that you have, the more likely you are to spend time with people from different backgrounds. We have a little asterisk to say it could be an indicator that people in metro areas have higher incomes due to cost of living, et cetera. And then one item from the rural poll that we wanted to bring to your attention today and in the index eventually is the importance of a sense of belonging in our communities. You can see from the bar graph here that most respondents or most people responded that they feel like they belong in their town or their community. However, as the table on the right shows, there is still significant work to be done to make our communities safe and welcoming places of opportunity for all people. Obviously, this data highlights rural Nebraska, but we know that there's work to be done in both urban and rural communities with regard to belonging and welcoming work. I told you it would be fast. Jumping into the next indicator, community engagement. These questions included volunteering activity, working with others to address issues, donating, attending public meetings, and group membership trends. I like to think of community engagement as the day-to-day actions of showing up for your community. So as we look at this graph or chart, we see that the two major takeaways is that Nebraska tends to do very well relative to the nation in community engagement. We rank in the top 10 or near the top 10 in all of these metrics, which is tremendous, something to celebrate. All of these metrics increased from 2013 with the notable exception of group memberships, which declined across the country. So somewhat astoundingly, hardly anyone responded not at all to volunteering, which is a great indicator that most people in Nebraska volunteer. Looking at participation in certain community engagement activities by groups, age groups, we see that the 65 plus age groups were the most active in volunteering, while the 35 to 54 age range were most likely to work with neighbors to do something positive and still had strong rates of volunteering and public meeting attendance. Not to call them super citizens, but they have high levels and steady levels of community engagement. Not seen here on this chart or graph is that 35 to 54-year-olds were also the most likely group to give charitably as well. So they're donating their time, their talent, and their treasure. When we drill down into public meetings, we see that more education and more income led to greater participation in this metric of community engagement. Non-metro or rural folks are slightly more likely to attend a public meeting than urban-based folks. But again, this is an increase across the board from 2013 to 2017, both in Nebraska and across the nation. People are more likely than they were in 2013 to attend a public meeting, which is not something I would have predicted. So a question for the community engagement focus groups to tackle will be, what are the consequences of the community engagement trends for your community or sector? What would it look like to advance community engagement opportunities for all Nebraskans, regardless of age or educational attainment? And you don't have to rush to write those down. We'll prompt you again. And then finally, political involvement. We get to this exciting indicator. Political involvement questions included voting and voter registration for the general election in 2018, voting in local elections, civil discourse, online civil discourse behaviors, contacting public officials, boycotting products based on political values, and donating to campaigns. You'll see here that there are some significant differences between CPS data shown based on the survey respondents. And in the next couple of slides, we'll show you some data from the Nebraska Secretary of State's database compiled by the Center for Public Affairs Research on UNO's campus. That being said, a few highlights to point out from these numbers. You can see that we rank in the top 10 in voting in local elections, although that decreased a little bit from 2013. Data points with higher figures from 2013 to our most recent 2017 figures were discussing politics with friends and family frequently, contacting or visiting a public official, and buying or boycotting a product for political reasons. So those things increased. People did more of those. Also, I think it's notable as you look at that very bottom row that how small of a percentage of the population here in Nebraska and across the nation contribute to political campaigns. Moving on, this is the data from UNO's Center for Public Affairs Research that they pulled from the Secretary of State's database for 2018's elections for voting and voter registration. On this slide, you'll see that the geographical distribution of voter turnout in 2018, with Black being less than 45% turnout, that's 12 counties across the state, and deep red being 60% or more turnout, that's 14 counties. So take a look at your county and see how this aligns with your understanding of voter education and outreach and accessibility. If you're in the political involvement breakout session later this morning, this is fodder for your conversation. Again, this UNO CPAR's office analyzed the data for voting and registration, and we see that voter turnout aligns with the CPS's estimate at 51% turnout for the 2018 midterm, but the registration data was significantly higher than CPS estimates because that's just a self-response. But we did see that only 11% of eligible voters were not registered to vote for the 2018 election, which is down. So there's your double negative for the day. It was an increase or pro behavior in terms of voter registration. When we look at the age breakdown of the 2018 election versus the 2014 election, we see that there was a big increase in younger age groups of 18 to 44, but increases across each age group. So from the 2014 midterm to the 2018 midterm, we saw higher turnout, which was great. And then when we look at the other demographic splits that we see in terms of civil discourse, so not voter turnout, but civil discourse, we see that 25% of high school grads discuss politics frequently, whereas nearly 50% of college grads discuss politics frequently with family and friends, which is about a 25% split. So that's significant. And 44% of people from metro or urban areas discuss politics frequently with friends and family, whereas just 33% of non-metro area folks discuss politics frequently, so an 11% decrease. I think we've all experienced probably a loss of friends, Facebook or otherwise, based on an inability to have civil conversations. So also for the political involvement breakout sessions, we'll be diving deeper into the real or perceived barriers to having constructive conversations about political or social issues. And then as we examine civil discourse in the online sphere, we see that the vast majority of Nebraskans, 8 out of 10 Nebraskans, do not post their political views on social media. So all of those posts that you think you see or do see is from a small and select few. Interestingly enough, there were no significant differences between age for this variable. So young people versus older adults, no significant difference in terms of their willingness to post. I'm going to turn it back over to Daniel here to focus us in these last 2 or 3 minutes, to focus us for our focus group work later today.
Okay, great. Thanks, Amanda. I did want to just, before we move on to that, I wanted to make a few comments that were made from the chat of questions. One, we had a question, is the CPS the same as the ACS? My understanding is no, that that's a different data set collected at a different time, and the topics aren't collected every year. Another point made by Rob McIntyre was that the data is useful to look at the percentages as well as the rankings, but the rank can exaggerate small differences. So comparing the ranks without looking at real differences between percentages can potentially mislead people into thinking that small differences are more meaningful than they might be. So, so thanks for those comments, and we'll keep those in mind. But did want to get now to your role of why we've gathered you here today. We know that this data is only part of the story. So in our focus groups this morning and this afternoon, we've invited you to help make meaning of the data and what additional issues or opportunities you see around civic health in the state. The data that Amanda shared provides us with some clues for what might be happening, but it doesn't provide information on where or account for the assets or say where we go from here. So your experiences will be critical in understanding civic health in the state. We're all relying on each other today to share our wisdom and also to really hear one another for what civic health means for our communities and our work.
As we finish out here, thank you again for joining us for this presentation of findings. We've known over the last 5 years that civic health is certainly something we all own together. So we're, again, grateful for your perspective and your insight as we move into our focus group sessions on how we can take really targeted and investment-driven action steps to expand our good civic health work across the state. Thanks for being here this morning. We look forward to seeing you at 10:30.